Thank you everyone so much for joining. My name is Maggie Jackson, and I'm the manager of Medicaid and Medicare marketing here at Henry Ford Health. And I will be your moderator for today's lecture on the 4 types of exercise everyone should be doing. This morning, you will hear from Vanessa Mier, an injury prevention specialist at Henry Ford Health. The Henry Ford Health Injury Prevention Team offers a variety of resources and classes to help our patients stay safe within our facilities and in their daily lives. Regardless of your physical ability, there are 4 types of exercises everyone should be doing to prevent falls and improve their mobility. In the next hour, Vanessa will review examples of each type and how to add them to your daily routines. These exercises will help reduce the risk of falling and can extend someone's independence. This is the second of 3 injury prevention webinars. Please visit the Healthy Living website or the link in the chat to register for the last injury prevention webinar on home modifications on September 18th. Following the presentation, we'll have a question and answer section. So if you have a question during or after the presentation, please type your question into the chat box and do not share any medical information. Also, to ensure a smoother experience for all, please turn off your cameras and note that your microphones have been muted. This lecture is being recorded and will be available to view in the next couple of weeks at henryford.com/healthylivinglectures. Now, I am happy to introduce Vanessa Mier.
Thanks, Maggie. Today's Living Healthy presentation is on the 4 types of exercises everyone should be doing. So why is fall prevention so important? 1 in 3 older Americans, 65 and up, fall every year, according to the National Council on Aging. So that equates to 36 million falls, and that's only what's being reported. Falls can lead to head trauma, broken bones, hip fractures, but even those falls that don't cause serious injury can have devastating effects, causing people to become depressed or fearful, and then continuing that cycle. But the good news is falls can be prevented by lowering your risk and knowing where to focus. So whether you're here for yourself or an aging parent or grandparent, neighbor, or friend, reducing those risks will help them stay healthy and independent for longer. Why is physical activity important? Well, physical activity is important for just about everyone, regardless of age and health, any comorbidities or physical problems. You can gain a lot by knowing where to focus your efforts to reduce those falls. Falls can lead to more hospitalizations, doctor's visits, and even medications for certain diseases. The good news is that keeping physically active can help improve your muscle strength or keep your current muscle strength. It can also improve your balance and lower your risk factors and your fall risk. It also gives you more energy and feeling less fatigue. Preventing falls is also great for people with arthritis, heart disease, 8 types of cancer, including breast and colon cancer, type 2 diabetes, and osteoporosis. It can also help you keep a healthy weight and manage your blood pressure and get that under control. It also helps with improving your cognitive function, helping your memory. It also helps reduce depression and anxiety and stress, and will lead to a better night's sleep. Now, physical activity and exercise often gets used interchangeably, but physical activity is anything that gets your body moving, that burns calories. Raking, walking, bringing in groceries, all your everyday activities. Exercises are structured, they're planned, they're usually repetitive, and it's what you think of with your aerobics classes, swimming, and any kind of dancing. Let's get into the 4 types of activities. Now, most people tend to focus on one type, but we know now that getting a good variety of all 4 will help lower your risk factors for falls and will also improve your everyday living. The first type of falls and the first type of exercises, to prevent falls are endurance exercises. And this is usually what people think about when I say think of an exercise. They think of an endurance exercise. So these exercises are also known as aerobics exercises, and they help with your breathing and your heart rate. And they improve circulation, your lungs, and your heart. Some examples of endurance exercises: going for a brisk walk, running, any sport, tennis, basketball, swimming, biking. This really gets your breathing and your heart rate going. How often should you do endurance exercises? You should build up to a goal of 150 minutes per week. So if you did 30 minutes a day on most days of the week, let's say 5, you'd get to that 150 minutes. Now that's your goal. You don't have to start there. You can start 5, 10 minutes a day on most days of the week, and you would get to that 150. A quick tip when you're trying to test your exercise intensity: try being talkative or singing when you're active. If you're able to still kind of breathe hard, but able to carry on a conversation, you're in moderate intensity. And that's the level everyone should be at. You don't want to go to where you're not able to get a few words out without taking a breath or stopping. That would be high intensity or vigorous intensity. If you're in that level, those people are active. They're exercising every day. And that's not the level everyone should be at. Everybody can get to moderate. Some safety tips for endurance exercises: you really need to start light. Do a little easy walking before and after your endurance exercising to warm up and to cool down. Listen to your body. Endurance exercises should never feel painful, tight in the chest, shouldn't feel like heartburn. You also need to make sure you're still drinking plenty of liquids. Now, if your doctor has told you to limit your intake for fluids, then make sure you check with them before increasing the amount that you take every day. And then be aware of what's around you, your surroundings. Keeping headphones in, looking at your phone. Cars can be backing up and driving, so you need to be aware of what's going on around you. Dress in layers, especially for hot and cold weather. You can remove and add layers as needed. And then using those safety equipment items. If you're going for a bike ride, wear a helmet. If you're going swimming in open water or boating, you can wear a life jacket. The second type of exercise everyone should be doing are strength exercises. Some people call this strength training or resistance training, and this helps your everyday activities. This helps you stay independent longer. It also will improve your balance and prevent falls and falls-related injuries. Some examples of this: carrying in your groceries, going for a walk up and down stairs, lifting weights, using resistance bands is a great example, or gripping a tennis ball. So how often should you be doing strength? It's not the same as endurance. There's not a set number of minutes, but you do want to focus on 2 days a week, giving those muscles strength training. And you can do that by doing maybe arm exercises on Tuesday and then leg exercises on Thursday, and giving a break in between those 2 days. Hand grip exercises with a tennis ball. If a tennis ball is too much for you to do gripping hand exercises, you can use Play-Doh. It's a lot softer and easy to move around and will help your hand grip. You can also put a tennis ball on the floor and do ankle rolls with it, and it will help with your flexibility. And you can also use the tennis ball to do a drop and catch. That way, It helps with your mind and hand-eye coordination and will get you moving. Henry Ford Health offers a program called Bounce Back, and it's exercises with a tennis ball the entire time. So there's lots of opportunities out there. Some safety tips for strengthening exercises. You don't want to work the same muscle groups 2 days in a row. So if I'm doing arm exercises, I'm not doing it again if I'm doing it on Tuesday, I'm not going to do it again on Wednesday. I'm going to give it a break. Like I said, you can do leg exercises 2 days down. Make sure you use proper form and holding on to those resistance bands. You don't want them to snap back at you. And then the proper form, avoiding locking those joints, locking your knees, locking your elbows, because that will restrict flow and can cause dizziness. Make sure you breathe out when you're lifting or pushing, and then breathe in when you relax. That way, you're able to get good air movement and you're not holding your breath. And then you always want to avoid jerking or thrusting those weights into place. It always should be a controlled movement. The third type of exercise is flexibility exercises. So these are also known as stretching exercises, and it's most important for physical and everyday activities. Reaching for things on a shelf, moving your neck to look in your blind spot while you're driving. So the only thing is, flexibility exercises will not help with endurance or strengthening, which is important to get that variety. Some examples are back stretching, like the woman in the picture on the bottom. You could also stretch your back by turning in a chair. And then inner thigh stretching, a hula hoop stretch. You don't need an actual hula hoop. You just pretend like you have one and moving those hips and keeping those flexible. Calf stretches, ankle and wrist stretches. So the woman in the middle picture is stretching those wrists. And then yoga is also a really great option. So these types of exercises should be done weekly, and you're going to increase in your time or your repetitions. So maybe I hold the stretch for 10 seconds this week, and the next week I increase it to 20. Or repetition, I'm going to do the hula hoop stretch 5 times in one direction, and then next week I increase it to 10. So it's not like the endurance where it's so many minutes a week. It's more about increasing the length of time and the repetition of how many times you do it over time. Some safety tips for flexibility. You always need to warm up your muscles. It's great to do flexibility exercises after your endurance and strengthening exercises, and that's when stretching in your muscles need it the most. You don't want to stretch until it hurts. If you pull a muscle, it can take weeks or months to recover from that. You want to make sure you're not holding your breath in a stretch. And then you never want to bounce into that stretch, like pushing your body more into the stretch, because it can cause your muscles to tighten up and actually tear if possible. The fourth type of exercise is balance exercises. These exercises improve your ability to resist forces both inside your body and out. And exercises that focus on your abdomen, your mid-region, and your lower body, those strengthening exercises will improve balance. So some examples is walking heel to toe or walking a tightrope, sitting to standing, going from a chair sitting and then using those lower muscles to stand. Tai Chi is a great exercise program. It's slow, purposeful movement. Using standing on one foot. So if standing on one foot may be difficult at first, you could hold on to a chair and then test yourself and see how long you can stand without holding on to something. Heel toe raises or going onto your tippy toes and holding that is also really great for testing your balance. And then marching in place. So how often are you supposed to do balance exercises? You're to increase weekly or increase over time. So if I'm marching in place for 10 seconds this week, I'm going to do 20 seconds next. Some safety tips for balance exercise: make sure you have a sturdy chair, something without wheels, something that's not very easy to push. If you're going to hold on to somebody, make sure they have balance as well. We don't recommend wheelchairs or walkers. Even if they lock, they can become unsteady. So following your exercises while keeping your eyes open and in the direction that you're moving will help decrease dizziness. And you're going to take extra caution if you're on medications or certain conditions like vertigo or orthostatic hypotension that can cause you to get dizzy. You need to take some extra caution. You're going to want to wear clothes that is loose fitting but comfortable so it doesn't get caught on anything, and then wearing appropriate shoes that allow you to move around and test that balance. There are online programs that are follow along if you like to do that. You can go to YouTube or Google and search Go for Life exercises. They have a ton. There are some that are cool down, warm ups. There are ones broken down by minutes. So if you only have 10 minutes, there's videos you can follow along with. And they also have videos that focus on the 4 type: the strengthening, the balance, the endurance, the flexibility. Okay, Vanessa, you said everyone should be doing these, but what if you have a chronic health condition? Well, people with Alzheimer's disease, if you have a family member, walking is great for caregivers too. Use an exercise video that I just showed, but be realistic because maybe they can only do a small amount of time. So maybe some mini workouts would be better. Doing some light household dusting, washing dishes is really great for people with Alzheimer's. Get a balloon, blow the balloon up and try and have them keep the balloon in the air. That works a lot with your hand-eye coordination and will also help with stretching as well. Having physical activity and exercise in somebody's life with Alzheimer's or dementia improves mood, improves sleeping and toileting habits, and can help maintain or improve weight. If you have arthritis or are pre-arthritis, you know that losing weight helps with joint inflammation and stiffness. So being physically active can help with that. It can also help reduce joint pain and help with weight loss, being physically active. If you're pre-diabetic, you know that having a healthy eating, weight loss, and being physically active can help the progression of diabetes. But if you already have it, then exercise is great too and can help manage and keep you healthy longer. So walking is great for people with diabetes and can help maintain a stable glucose level. So people with cancer have also found that physical activity has been great, both pre and post diagnosis, can also help with some of the cancer side effects from medications, can also improve survival rates. If you have chronic obstructive pulmonary disease, talking with your healthcare provider or pulmonologist or pulmonary therapist, they can provide you with exercises that are specific to improving your lung capacity, helping you breathe better, helping those everyday activities. If you have heart disease, eating healthy, maintaining a healthy weight, and aiming to become more physically active can really help. It contributes to your heart health. Being inactive, people are twice as likely to develop heart disease than those people that are active. So it can also help with your cholesterol levels, your blood pressure, diabetes, and prevent obesity. Being physically active is one of the most important things that you can do to keep your heart healthy. If you have osteoporosis, focusing on those weight-bearing exercises that make you work against gravity, like walking, jogging, dancing are great examples. And you want to do this about 3 to 4 times a week. And those are best for preventing osteoporosis. You can also try some strengthening and balancing exercises to help avoid a fall, which could cause a bone to break. So the bottom line is we know that nowadays everyone can benefit from these 4 types of exercises. So you have a lot more to lose if you're not being active. You want to find something that you enjoy doing, take a class, add it to a task that you're already doing. Routine is great, but having that variety in place will keep things fresh and you're more likely to commit to things longer. So increase over time, like that endurance, 150 minutes is that goal. So start 5-10 minutes a day is great. Use items you already have. If you don't have weights, you can use water bottles or cans and then increase over time. And then you're able to get that strengthening up. And then always listen to your body. Find what works for you and stick to it. I'm going to turn it over to Maggie to see if there's any questions in the chat box.
Yes, thank you so much, Vanessa. Just a reminder, this is the second of 3 injury prevention webinars. The last one is on September 18th. I did just drop the link in the chat, so feel free to register. All right, let's see. Yoga and Tai Chi sound intimidating. Do you have a recommendation if I've never taken a class before?
Yes, great question. So although it can sound intimidating, when registering for a class, look for something that says Tai Chi for all ages, suitable for all ages, yoga for beginners, yoga for seniors, all are great options.
Great. And does your team offer in-person classes or virtual classes?
We do have in-person and virtual classes. If you're looking for an in-person class, I recommend going to the Henry Ford calendar page and searching falls or exercise. Less is more and will get you to the classes that you want and that are near you.
Perfect. And I am dropping a link to the Henry Ford class calendar into the chat.
Thank you.
All right. Let's see. I can't seem to stick to exercise plans. Do you have any recommendations to help me stay more consistent?
Yes. Find a buddy, somebody that'll hold you accountable. I find that tracking and keeping a calendar of what I did, how long I did it, helps me increase over time. And find something that you love that you're going to stick to. You're not going to find me running. So I'm going to do my swimming and dancing and things like that.
All right, let's see what else. I recently had hip surgery. Are there specific exercises I should be doing or avoiding?
Great question. You have to talk with your healthcare provider. They're going to be great at finding something that's specific for you. Physical therapist and occupational therapist is also a really great choice.
Great. And can you repeat what the difference is between moderate intensity activities and vigorous intensity?
Yes. So the moderate intensity is a great intensity for everybody. That's your goal to get to. And what you want to do is have a conversation while you're exercising, talk, sing while you're exercising. And if you're able to get through those exercises, get a couple words out before taking a breath, you're in the right level. Vigorous or high intensity is great for the people that are very active already, that run miles a day. If you're not already very active and getting into that high intensity, vigorous intensity can be very harmful for your body, not just as you're doing it, but days, hours later, you can feel the effects.
Perfect. And we do have a question on if this was recorded, and it is. So I am going to drop a link in the chat too, where you can watch this webinar in the next couple of weeks, as well as other healthy living webinars as well. All right. So I don't see any more questions in the chat, but Vanessa, if people want to learn more about the injury prevention program, where can they go?
They can search Henry Ford Health Injury Prevention. You can meet the whole team. We have injury prevention professionals across the state.
Wonderful, wonderful. And as another final reminder, the third and final injury prevention webinar through the Healthy Living Program will take place on September 18th at 11:30 on home modifications you can make. So as a reminder, this lecture has been recorded and will be available to watch again or share with your friends and family members. Visit henryford.com/healthylivinglectures to view the presentation. The recording will be available in the next couple of weeks. On behalf of Vanessa and the Senior Healthy Living Program, thank you for joining us and enjoy the rest of your day.